Hey, what's going on, guys? This is Dr. Collins again on one of my segments, Ask Dr. Tooth. You know, we're doing today again. We have another patient that we have done this neurotherapy on, where I go in and I actually see sometimes chronic infection in a patient's mouth, and from that chronic infection from a root canal tooth that they've had from back in the days, or it could be in just an old tooth that just haven't had any problems, but it actually has some infection around the tooth that the patient doesn't know, and sometimes even the dentist doesn't know, depending on what type of x-rays that they have. Fortunately, I have what you call it's a CBCT, which is a cone beam, and what that is a three-dimensional x-ray unit that I can see I can see a tooth all around that particular tooth, and sometimes can determine that this patient may have infection. All right, so what we did today, this is our good patient, Miss Hart. She came in today, saying, "What's going on, Miss Hart?" We appreciate her. This is her second appointment with us. She came in about when we first opened up in January, December, and so we thank God she's still coming in and see us. What happened today? We're doing a normal exam today, and we notice again that she has some chronic infection. This is here. We look at this tooth here. We can see down here at the bottom of this area, she actually has some black area. That's what this bacteria, that's somewhat of an infection right here. And so I immediately asked her, has she been going through some discomfort, some pain? She told me she's gotten that tooth fixed several times. It's an old root canal tooth, and it just hadn't been working for her. So I asked her, has she had any pain? She said her knee was hurting. Her foot was hurting. And so I decided I wanted to go ahead and do what we call neurotherapy on her. And that is where I go in and I find areas around her mouth, her tooth, and I put some a solution around that area. And basically what happens, if she has comfort afterwards, guess what happens? That foot will start to feel better. So let's go, and we're going to actually have Ms. Hart tell us what happened for her today and what we did for her today. Ms. Hart, go ahead.
I came in today. I did have discomfort in my foot,
She was limping.
my neck, and my shoulder. I limped into the building. If there's cameras at the door, you can see me limping in. After he did the injection, the pain in my foot was relieved. Like, I got up and walked from the other exam room to here, and I didn't have to limp. Normally, upon standing up at any position, it hurts my foot. As far as my neck, I have bulging disc in C3, 4, 5, 6, and 7. Very painful. Even while I was here, I had to sit up in the chair because my neck was bothering me from just leaning back. I have no pain right now in my neck at all, and I'm happy about that. I don't know what miracle drug he put in there, but it helped. Even the tooth, I didn't have any pain in it, but whatever it was, I'm good.
Well, we want to just kind of say this is nothing brand new, and I've talked about this before. Basically, your body itself has 12 cranial nerves in your head. Your head, basically your brain, only has 12 nerves. However, you have a million nerves in your body. I'm not saying a million, I don't know how many you have, but you have a lot of them. And everything's connected, right? And so what happens is sometimes when you have infection in one part of your body, you can be having problems somewhere else. And I think especially when you have chronic infections, she has chronic infections. The problem is, again, as I mentioned before, for some reasons we have conditioned ourselves to believe that medical and dental are different, that it doesn't affect one another. And in reality, it does on so many ways. And so what happened is that she actually has, it's called the meridians. Meridians basically shows you, basically where a tooth can be causing problems throughout your body. It's an amazing thing. I have now done about 10 patients, and we're continually looking at patients and trying to find out if they have chronic infection. And it's just been really a fun thing for me in this past month. 21 years I've been practicing dentistry, and now I would have never guessed that this was even possible. And now, even when we met in January, I didn't have any clue about this then. It's only until now that I did. So anyway, hey, listen, thanks for joining me on my segment, Ask Dr. Tooth. You can find me at Dentist in Manville. That's Dentist, DENTISTNIN, Manville.com. You can call us at 832-637-4977. Stay Gucci. Holla at me. Appreciate you.